Hello and welcome. Let's talk about open fracture. So, what does it mean by open fracture? The fracture which is communicated with external air through the wound of the skin and soft tissue is called open fracture. The wound is usually a small, clean puncture through which a bone speck has protruded. There is little soft tissue damage with no crossing. Now, this is a picture showing open and closed fracture. The open fracture shows a protruded bone, while closed fracture doesn't show any protruded bone. Now, classification of open fracture. Type 1. The fracture is not comminuted. The wound is usually small, clean puncture through which a bone speck has protruded. There is a little soft tissue damage with no crossing. Type 2 fracture. The wound is more than 1 cm long, but there is no skin flap. There is not much soft tissue damage and no more than moderate crossing or comminution of the fracture. Type 3. There is a large laceration, extensive damage to the skin and underlying soft tissue, and in of the most severe cases, vascular compromise. The injury is caused by high energy transfer to the bone and soft tissues. Contamination can be significant. Type 3 is further divided into type 3A, B and C. Type 3A. The fractured bone can be adequately covered by soft tissue despite the laceration fracture pattern. Type 3B. There is extensive periosteal stripping and fracture cover is not possible without use of the local or distant flaps. Type 3C. There is an arterial injury that needs to be repaired regardless of the amount of the other soft tissue damage. Now, this is a picture showing different types of open fracture. Type 1, Type 2, Type 3A, B, C. Now, principles of treatment of open fracture. All open fractures, no matter how trivial they may seem, must be assumed to be contaminated, and it is important to try to prevent them from becoming infected. The 4 essentials are antibiotic prophylaxis, urgent wound and fracture debridement, early definitive wound cover, and stabilization of the fracture. Management of the open fracture. Removal of all dirty clothing, thorough examination of the patient including pulse, BP and temperature, opening of an intravenous line, and blood should be sent for grouping and cross-matching, administration of the IV fluid infusion and blood transfusion, and parenteral antibiotics should be started, covering of the wound with clean gauze, cotton and bandage, and application of the pressure bandage in case of bleeding wound, and avoiding of the tourniquet like plaster, and tetanus prophylaxis with injection of tetanus immunoglobulin human intramuscularly should be given, and prophylaxis against gangrene, gas gangrene should be given by injection of the anti-gas gangrene serum about 10,000 units, and preparing the patient for anesthesia as well as taking the patient to the operation theatre. Now, operative treatment. The operative treatment includes surgical toileting where wound is washed thoroughly with normal saline or hydrogen peroxide. Debridement includes all devitalized tissues and dirty materials should be cleaned. Reduction and if necessary internal fixation of the fracture and repairing of the soft tissue, muscle which are injured, and identification of the tendon, vessels and nerve and taking the necessary steps. Closure of the wound without tension or keeping the wound open, and applying the sterile dressing and external immobilization using plaster. What are the complications of open fracture? Hemorrhage and shock which may lead to death, wound infection and sepsis, septicemia and pyemia, tetanus, gangrene, chronic osteomyelitis, non-union, malunion and delayed union, joint stiffness. End of the topic.